Now here we are again with a very much interesting ECG. You can simply pause the video and you can see this ECG for a second. Now what we can see in this patient the heart rate is around 43. So the patient's heart rate is around 43 and we can try to find out the reason for bradycardia. So whenever it is bradycardia we always think of block. It can be type 1 block, type 2 block, or complete heart block, which is type 3 block. So, before going to complete heart block or type 3 block, I would like to tell about type 2 block, which is Mobitz block. So, it can be either Mobitz 1 or Mobitz 2. What is Mobitz 1? Is there is a gradual prolongation of PR interval. So, here this is P and this is QRS. So there will be a gradual prolongation of PR interval and then there will be drop in QRS. That will be Mobitz 1. So in here we can see that the PR is this much. Here the P is there but QRS is not there. Here the PR is around 200 milliseconds and here it is directly dropped. So here the prolongation is not there. In fact, if you see here P is there and QRS is here and this is T wave basically. This is P. So there is no QRS here. So that is directly dropped. So in this ECG, there is no PR prolongation and there is directly drop in QRS complex. Here also, P is there, QRS is there. This is T wave. This is again P and there is drop in QRS. So this is not at all Mobitz 1. What is Mobitz 2? In Mobitz 2, what we have is PR interval is constant, but it is still followed by a drop in QRS. So is it here that scenario is saying, is it PR is constant or not? We can simply see the PR, this is P and this is R, though there are around 7 small boxes in between. Here it is only around 4 to 5 boxes. Here hardly 2 to 3 boxes. Here it is hardly 1 box. So this PR is not at all constant in this scenario. So it is not Mobitz 1, not Mobitz 2. It means there is only one block which remains, that is complete heart block. What is the definition of complete heart block? The definition of complete heart block is there is AV dissociation. What is AV dissociation? It means there is no connection of this A wave with this QRS, this atrial P wave and ventricular QRS complex. There is no connection. So atria they fire at a different rate and ventricles they will fire at a different rate. That is what it is, uh, the definition of AV dissociation, and AV dissociation means it is complete heart block. So in case that is the same thing which is happening, the atria has their own rate which is totally different and it is not at all connected with this QRS complexes. So this QRS, even though it is appearing after this P, this is not at all connected with this P wave and this QRS is totally different. So you can see this has no connection, this has no connection, this has no connection. So P wave they are getting fired at their own pace and QRSs they are fired at own rate, and that is because as there is no connection between this atria and ventricles generate their own impulse. They cause their own QRS complex. That is how life is sustained. If this life is not sustained, then if P and QRS means atria and ventricle, if they are not connected, patient will simply die. So to prevent that death, our nature has given atrial rate which is 60 to 90, AV node rate which is around 40 to 60, and ventricular rate around 40. So whenever very commonly what our heart rate is, it always stays between 60 to 90. All P waves get connected to the ventricles and they get QRS, so the heart rate remains in between 60 to 90. When atria fail, that time AV node can pace the ventricle at the rate of 40 to 60. When AV node also fail, that time we don't have any choice than to originate a new rhythm at a rate of minimum of 40, that is ventricular rhythm. That is uh, that is the complete heart block rhythm. So this was an interesting case, interesting ECG of complete heart block. Thank you.